Niamh Field, and in this presentation I'll be covering optimising your vaccine strategy for your herd. So just starting off with infection control, the background context of where vaccination fits into that in your herd. So infection control is all about balance. It's a balance between infectious pressure on the one hand and immunity on the other. So when we talk about infectious pressure, we mean how much of a bacteria or virus is present in the herd and in the farm environment. So this is influenced by things including your hygiene practices, so your cleaning and disinfection strategy on farm, which will reduce the amount of bacteria and virus on the farm, and also the prevalence of disease in the herd, so how many animals are infected with the bacteria or virus. The more animals that are infected, the more likely it is that they're shedding bacteria or virus into the farm environment, which increases the infectious pressure. Infectious pressure, the higher it is, the more likely that there is continued spread of disease and you will see sick animals. On the other side of the balance, we have the animal's own immunity. This is influenced by things like colostrum intake as a calf and the nutritional status of the animals throughout their life. Things also such as stress can also decrease the animal's immunity. So where vaccination fits in this balance is it strengthens or boosts the immunity side of the balance. It can't, however, overcome extremely high infectious pressure. So even though you're vaccinating for a bacteria or virus, if there's a lot of it in the farm environment, a high prevalence of disease or poor hygiene measures in place, the vaccine alone won't be able to overcome the disease and won't be able to stop the incidence of clinical cases. So what goes into an optimal vaccination program? Well, there's a number of factors to think about. So firstly, you want your vaccine program to be personalized to your herd. So this is done with the help of your herd vet. First of all, they'll look at the disease profile of your herd. So what is currently circulating in the herd, which diseases are spreading, and what animal groups are affected. Then they'll look at the risk profile of your herd. So apart from diseases that are already present, what diseases are a risk to be brought in from the outside? So this will vary depending on the number of animals that you purchase per year and how risky those purchases are. Secondly, when you've decided what vaccines are necessary for your herd, you want to ensure that you're using them effectively. So firstly, when I think of this, I think of what animal groups need to be vaccinated. So different diseases will require different animals to be vaccinated. For example, IBR, in most cases it's necessary to vaccinate all the way from adult animals right down to calves to prevent transmission. Whereas in other cases like BVD and leptospirosis, it's only necessary maybe to vaccinate breeding animals. Then it's important to think about timing. So for many vaccines, they are most effective at certain times of the year or at certain stages of lactation. So this is best decided with a conversation with your vet. Which vaccines and when do I need to vaccinate the animals for it? So for example, the most common ones we would think of would be the pneumonia vaccine given pre-housing in most cases, or the calf scar vaccine, Rotavirus corona, given pre-calving. And then it's very important to think about the method you're using when vaccinating. And this can vary considerably depending on which vaccine it is you're using. Some vaccines need 5 mils, some need 2 mils, some go under the skin, some go into the muscle, and it's very important to think about the storage conditions for the vaccine. In general, you can't have them in any contact with sunlight and they need to be kept at the correct temperature or they won't work. Lastly then, I think an optimal vaccine program is one that's monitored. And this is a concept that can be difficult to get your head around. But when you're spending so much money on your vaccine program, vaccinating a large herd, you want to ensure that you're getting the best value for your money and that the vaccine program is working as it should and that it doesn't need to be tweaked to make it more effective. So some simple ways that you can monitor the effectiveness of your vaccine program are by using bulk milk antibody testing, for example. So in the picture on the screen, you can see a printout of a bulk milk antibody screen with the herd details taken away. But there's many different diseases that you can screen for, and it can be done multiple times throughout the year. So in this herd, they're doing it 4 times a year, and you can see how the antibody levels trend up or down depending on how much antibody is present in the bulk milk sample. So in a herd that's vaccinating for a lot of different diseases, the most useful one to screen on bulk milk antibodies would be IBR, because with this antibody, the bulk milk test can differentiate between antibodies that are due to the vaccine or antibodies that are due to the wild virus. And if you're vaccinating for IBR, on your bulk milk samples, you'd like to see that the antibody levels are trending downwards gradually over time. It's very useful as well to keep an eye on your clinical case records. So mark down how many animals are aborting, if any, and also clinical cases of suspect IBR or Salmonella, just to make sure that if you're vaccinating for these diseases, you shouldn't be having suspect clinical cases. Blood sampling is also an option, random sampling of a certain amount of animals, and this discussion can happen with your vet too. And lastly, I just want to put on the screen a sample timeline for vaccinations in a spring calving herd. So just bearing in mind that this is an example only, but it does illustrate how busy things can get in a herd that are using a lot of vaccines. So on the top line, you can see these are vaccines that you'd give to your cows, heifers, and bulls. And on the bottom line, vaccines that would be given to calves. So you can see that it can be quite busy, particularly the start of the year around springtime. And bearing in mind that a lot of these vaccines, when given for the first time in young stock, they'll require 2 shots. So it's very important that year on year you sit down with a calendar, mark everything into it for your herd, the timings, and make sure it fits in with your schedule and everything else that needs to happen on the farm. A couple of things just to maybe point out, in particular in this sample timeline. So in this herd, they're giving their BVD and leptospirosis vaccine in springtime to hit that optimal window of pre-breeding for those vaccines. Now, this is obviously quite a busy time of year. So although the vaccine companies recommend that they're given about a month pre-breeding, you can maybe push that back to late winter if it suits you better. But again, check this with your vet. Also, this farm is vaccinating with the calf scar vaccine, the Rotavet Corona. This needs to be given 12 to 3 weeks pre-calving. And it's important to note that the calves will only receive the benefit of the vaccine from the antibodies as long as they're ingesting colostrum or transition milk, because the antibodies act locally in the gut. So it's important, if you're having trouble with calf scar on your farm, that you ensure that maybe the calves continue to receive transition milk for more than the first couple of days of life. And that's everything. Thanks very much.